Hey everybody, welcome to this week's vlog. Well, this is a couple of weeks worth of updates because I haven't done an update in like 3 weeks. And you'll see why in this video. I have been so incredibly sick and a lot has been going on, so I have a lot to update you on. The first thing is, beside the fact that I've been sick, I went to a doctor's appointment about a week and a half ago, and no, it's been about a week ago, and I had lost too much weight, and I haven't been keeping anything down really, even with the oral Zofran, and I've had a really hard time eating or drinking anything. And so the doctor, we tried a bunch of different medications on top of the Zofran and nothing was working. It's either making me more sick or I don't know, it was just crazy. So she decided to have me either hospitalized or to get a PICC line. I obviously chose a PICC line because I'm not in a hospital, and it's going okay. I've had it for about a week, and it's not the most comfortable thing to have in your arm, but it's going okay. So I'll show it to you. Take my long sleeve shirt off and show you. It's right here. Oh, I just pulled all the dressings off of it too. So I have 2 ports, and I try to do like one in the morning, one at night, and just remember the color. So I used the red one this morning, so this afternoon I'll use the purple one, and then later in the day I have to do IV bags, and so I'll use the red one again. It's just right there in my arm. So we'll talk about it though. So getting the PICC line, just dress this really quick, was painful. They numb you, but it's still not, I don't know how to explain it. It's a sterile surgical procedure. I don't know if it's technically a surgical procedure, but it's a sterile procedure that's done by a cardiologist and a radiologist. They have a cardiologist do it as well because at least they did with mine, because the PICC line goes down so close to your heart, they have to make sure it's going to be safe. So mine is 36 centimeters long. All of them are different lengths depending on where they put it. Mine's up kind of high, and how close it is to the heart. They take pictures during the whole thing so they can see how close they're getting to make sure it's still safe. So mine's 36 centimeters, and they actually blew the vein the first time, so they had to do a different vein and try again, and the second time they were able to get a successful vein. So I'm going to show you a basic of every time what my daily routine is for the PICC line every day. So in the morning, I get up an hour before my day needs to start and get the Zofran out of the fridge. I'll insert a picture of that right here. And the Zofran, it's like you can see, it's in that little bulb with the tubing on it. That I take in the morning. So the first thing I do is I wash my hands, and then I put some gloves on. They're not sterilely like packaged gloves, they're just a box of gloves. So I put some gloves on, and then I choose what port I'm going to use and clean it off with an alcohol wipey. And without touching it to anything else, I flush it with saline, and then hook up the Zofran without touching it to anything else. If it touches anything, we have to reuse an alcohol pad, a new one, just to keep it sterile and clean. So, oh, I forgot to mention, they do a dressing change that's a sterile dressing change once a week. So that'll be coming on Wednesday to do that. But anyway, so once the Zofran has gone all the way through, the balloon is completely deflated, which I'll insert a picture of what it looks like after it's used right here. So once it's completely deflated, then you use another saline to flush the rest of the Zofran through. And then you do a heparin lock. So you put heparin through, which is this blue tube one. And then before you stop pushing the heparin, you actually have to clamp the line closed so that there's no blood return back in. When you're flushing the first time and then after the Zofran, you actually, when you're halfway done with the saline, you have to pull it back through, like pull it back to see if there's blood that returns into it, and then push it the rest of the way through. If there's not blood, it's not a big deal. You just want, it's ideal to get blood back. It doesn't mean you have to, it's just ideal. So I do that morning and afternoon. I do it in the morning when I get up, and then about 3 or 4 o'clock in the afternoon. And then I have that netting that you saw over it. I change that probably every 3 days just to keep it a clean one on. And then I also change the little gauze, which is in this package. It's sterile gauze that goes around the ports. It just adds a little bit of padding because the clamp parts kind of dig into your arm a bit, and so this just helps that. So I do that, and then every other day I do an IV. I have an IV pull over there, and this is the saline, not saline, the IV injection. It's 0.09 sodium chloride injection. It's 1,000 milliliters. I do 2 of these. So 2,000 milliliters of fluid every other day. I actually do it in the evening after the kids go to bed. I just watch a show or get on YouTube or whatever and just let it pump through. So to start the IV, what I have to do is, maybe I'll do a video on this. I know it'll be hard to film though and do it at the same time, so that's why I'm just going to explain it for now. But maybe my husband's next day off will film a video of it. So when you're starting the IV, you put gloves on after you wash your hands, clean with one of these, flush with saline, and you take the little blue tab off right there, and then in this packaging, you take this little part off and you just puncture this through where you pulled off the blue tab. And then you have to prime the lining, so you you squeeze this until it fills up with IV fluid. You unlock the thing and you just drain the fluid through until all the air pockets are out. Usually into a garbage can out this end because it will spray everywhere. Once all the air pockets are out, then you lock it so it stops spraying. And then you just connect it just like all the other connectors to the arm. There's this little screw-on thing right here, and it screws the end pieces kind of high up there. There we go. So this little screw-on part right here screws right onto my outlet. So the outlet that I have in my arm, I have 2 of them. It fits all of these connectors. They're all universal, so that it's really easy to do at home. So I've been doing this for, I think Thursday was the first day I had IVs at home and Zofran and all that stuff. Thursday last week. So I was 12 weeks and 4 days pregnant when we had to start this. And you know, it's not typical to get PICC lines. It doesn't happen for everyone. It's not something that most people have to do. But given my history of getting super sick, and then I was just, before the PICC line, diagnosed with hyperemesis, or HG. If you don't know what it is, you can Google it. And it's just for the safety of me and the baby. There are some risks involved. There's risks of blood clots. That's why we use heparin. It's a blood thinner and it helps to keep the lines clear. And you know, there's risk of infection, and so that's why they do a sterile dressing change. And then I try really hard to keep everything sterile and clean. You cannot get it wet, which is by far the hardest part about having it, because I'm a mom and I like to shower. So those 2 things combined make it very difficult. Things like doing dishes and, you know, bathing my kids, and things that normally are really easy to do are not so easy to do anymore. I have to wrap it up every time you do dishes or bathe the kids or take a shower or wash your hair or any of those things. And so it has impacted us a lot that way. However, it's way nicer to do IVs at home. From the last time I did an update until now, I've been going in and getting IVs every other day at the hospital. Every other day, faithfully. If I missed a day, I was screwed and sick as could be. I had extreme dehydration, and my liver enzymes were going up because I was so dehydrated. And so that's a side effect of, or one of the symptoms of HG, is your liver enzymes will both be elevated a little bit, or just one slightly. So there's just been a lot going on, and doing IVs at home and not having to sit in a hospital for 3 to 4 or possibly even 5 hours, depending on what's going on and how busy the nurses are, is a huge improvement. It was so hard going to the hospital all the time. Thank goodness Tim had a month off of work completely. He didn't go to work at all. And it was so nice because he was able to take the kids and just entertain them and be with them, and I didn't have to stress about babysitters and all that stuff. But now I can just do this from just the comfort of my own home, which I really like. Aside from having something in my arm all the time, I really like being able to be home. So that's good. And another thing too is I am at every other week appointments at the doctor right now. Normally at this point in pregnancy, it's every 4 weeks. But for me, because I've been so sick and she needs to keep a closer eye on me and also on my PICC line, she is having me come every other week. So that's different for me. And I'm having a hard time getting comfortable sleeping because there's something in my arm and it's not very comfortable and you can't sleep on it. And if you lean on it at all, it like digs into your arm and pushes, and it just doesn't feel good. So it's definitely not the funnest thing to have, but it's not the worst thing either. There's far worse things that could be going on in this pregnancy than that. So I'm just going to be grateful for how it is going and that it's not worse. And that I'm not hospitalized, because honestly, I don't know what the heck I would do if I was hospitalized. I have children and things to do and their schedules, and it just would be super hard. So I'm really grateful that I have this option of doing it this way. So the downside is no traveling. I can't go see my family right now, and that really sucks. And I haven't been able to go since I've been pregnant because I've been really sick, so that's been hard. Other than the no traveling part, it's not that bad. I'm not on home, whatever it's called, homebound. I can go places. I can go to the grocery store. I can go pick up my kids. I can take them to school. I can do all of the things that I would normally be doing. I just have to be careful with my arm and be careful, you know, that I don't do too much, or that I don't lift and put a lot of pressure right there, or those kinds of things. And for the first couple days I had it, it really hurt to flex my arm at all. So just picking up little things, it hurt. But now I'm doing fine, and it could be worse. And I'm still sick. I still throw up a lot, but I am able to keep more fluid down and not be as sick. So I'm really grateful for that. And I think that's pretty much it for an update. Sorry it took me so long to put one up. I've just been very sick and a lot's been going on, and it's just been chaos. We need to get back into a normal routine, and I'm hoping that our new normal routine will start to get more into place, and things will start to just flow better than they have been, so that I can get back to updates a lot more often and things can just be more normal than they've been. I know it's not going to be normal, but like a new normal. So that is all for now. Thank you so much for watching, and all the new subscribers, welcome. There are a lot of you, and yeah, thanks for being patient with waiting on new updates and vlogs, and just being patient with me on this craziness that's going on. That's pretty much it for an update. So I will talk to you all later. Bye!